Dear students, today I will discuss about the liver. Liver is an accessory organ of digestive system and this is the largest gland in the body. Liver is situated in the right upper abdomen. Dear students, this is a model of liver. Morphologically, liver looks a little like a four-sided pyramid. That means it has 5 surfaces. The surfaces are anterior surface, posterior surface, superior surface, inferior surface, and the right surface. Remember, the liver have anterior surface, posterior surface, superior surface, inferior surface, but only the right surface, not the left surface. The borders, among all the borders, only the inferior border is clearly marked. The inferior surface is separated from other surfaces by this inferior border. The other borders that separates anterior surface from the superior or right surface and the superior surface from the other surfaces, these borders are not very well marked. The liver is broadly divided in 2 lobes and it has also 2 accessory lobes. The major 2 lobes are right lobe and the left lobe. Right lobe is much larger than the left lobe. Anteriorly, the right lobe is divided by falciform ligament, and posteriorly, the right lobe is separated from the left lobe by ligamentum venosum. And on inferiorly, this division is made by the ligamentum teres. The 2 accessory lobes are quadrate lobe and caudate lobe, but these lobes are only visible from the inferior surface and the posterior surface. From the inferior surface, in between the fossa for gallbladder or the gallbladder and the ligamentum teres, there is a quadrangular area. This is quadrate lobe. And from the posterior surface, in between the inferior vena cava and the ligamentum venosum, there is an elongated area. This is known as caudate lobe. Remember, this is inferior vena cava. On the inferior surface of the liver, there is an area through which the portal vein, the hepatic artery, and some nerves enter the liver, and the bile duct and some lymphatics leaves the liver. This area is known as porta hepatis. The inferior surface is related with different organs. For these organs, there are some depressions, commonly known as impressions. From the right side to left side, these impressions are: this is a renal impression for right kidney. This is suprarenal impression for the right suprarenal gland. This is colic impression for the right colic flexure and part of transverse colon. This is duodenal impression which remain in touch with the duodenum. This part is for omentum, pyloric part of the stomach, and in empty stomach also for the first part of duodenum. This is a large impression. This is gastric impression, and the stomach remain in touch with this, and just here a small impression for the esophagus. I want to repeat again, the inferior surface of the liver remains in relation with many organs, and for each of these organs there is impression on the inferior surface. From the right to left, these impressions are, this is renal impression where the right kidney remain attached. This is suprarenal impression for right suprarenal gland. This is colic impression where the right flexure of colon or the hepatic flexure of colon remain in touch along with some transverse colon. This is for duodenum where the duodenum remain in touch. This impression for pylorus of stomach, omentum, and partly for the duodenum. And this is a large impression for stomach known as gastric impression, and this part remain in touch with the esophagus. And also obviously the gallbladder, which is present here in the gallbladder fossa. The gallbladder has three parts. The most anterior part is fundus, the next part is body, and the posterior part is neck. So the fundus, body, and neck. The function of gallbladder is to store bile, concentrate bile, and the release of bile as and when needed. Thank you.